Hello again, it's Makoto Trotter, naturopathic doctor, and today I wanted to talk to you about your menstrual cycle, as particularly menstrual cycle irregularities. I do see a lot of women in my practice who have menstrual cycle irregularities, which can mean intense premenstrual symptoms, which can be a week up to 2 weeks before your cycle, and it can also mean irregular periods or painful or heavy bleeding during your period. So these are all things that can greatly affect your quality of life. So I want to talk to you about 4 important things that are important to know about your menstrual cycle. The first thing I wanted to talk about is understanding your menstrual cycle. The first thing is the timing is what we have to understand. So a common misconception is that day 1 of your period is the first day after your period. It's actually the first day that you start your period, and that's how you count from one cycle to the next and determine its length. Thankfully, there's many apps. There's an app for that, and there's many apps to help track your menstrual cycle. One of them is Kindara, Kindara. Another one is P Tracker, the letter P, like period tracker, and another one is Life, and there are many others. But get in touch with your cycle in terms of tracking the date that it's starting and ending, how long the flow is, track your symptoms mid-cycle, during your cycle, and then when we have that information in a few months, you can look back and assess if your cycle is regular or not, and how serious the symptoms are. They might be affecting greatly your quality of life, and I have some patients who even plan holidays around their menstrual cycle, and that shouldn't be the way that it is, and that's not normal. On that note, number 2, important point is that it is not normal to be uncomfortable during your period. You don't have to live with these symptoms. If you're on a birth control pill that maybe has regulated your cycle, but you're still suffering, there are a lot of other options or things that you can do besides just birth control pills and switching between birth control pills. On that note, important point number 3 is that diet and lifestyle can make an impact on your periods. As naturopaths, these are tools that we implement. Diet, lifestyle, in addition, certain herbs, female herbs is what they call, that can help you regulate your progesterone and estrogen levels. Now, if you're on birth control pills, we have to be careful, and you have to talk to a medical professional like a naturopath to understand the interactions, because we don't want to impact the contraceptive effect of the birth control pill. That being said, if you're on the pill, we still have a lot of options and tools we can use to help make your cycle more comfortable, more regular. And then on top of that, there are things like bioidentical hormones that we can use, and other treatments like acupuncture that can be great in helping regulate your cycle. Important point number 4 is that the hormone tests that your doctor may have done for you or may not have done are blood hormone tests. They give you a little bit of information. I find at least in Canada, doctors aren't always keen on looking at hormone levels when it comes to regular menstrual cycle irregularities. So unless there's something major like endometriosis, PCOS, or polycystic ovarian syndrome, which can make for very painful or irregular cycles, these things you want to bring up with your doctor, and you could do more tests to explore. Even if the common hormone test that they might check might say that everything's normal, if you're not feeling normal, then things likely aren't normal. We have access as naturopaths to many private hormone tests, such as the Dutch hormone test, which is tested through urine, or the saliva hormone test, which gives you much more information about what your body's actually doing with these hormones and how you're processing these hormones. And it gives us a better idea of what's going on in terms of your estrogen, progesterone, even stress hormones and testosterone that can all be playing a role in impacting your cycle. So hopefully those 4 important points will help you out, and I'm happy to help you out as a naturopath, or you can speak to your own naturopath about regulating your cycle. Please subscribe below if you like this video, and give me a thumbs up, and there's more information on our website about options for hormones and hormone testing.